You've probably seen it in movies. The character with multiple personalities, sudden voice changes, or memory gaps. But Hollywood doesn't tell the whole story, because behind the drama and the myths is a very real condition, one rooted in trauma, not theatrics. This is dissociative identity disorder, and today we're talking about what it truly is, what it's not, and why it's time we replace fear with understanding. What is dissociative identity disorder? Dissociative identity disorder, or DID, is a complex mental health condition. It involves the presence of two or more distinct identities, or alters, within a single individual. Each identity may have its own name, age, voice, memories, and behaviors. And the person with dissociative identity disorder may switch between these identities without warning. But here's what most people don't know. Dissociative identity disorder is not about attention-seeking. It's not a quirk or a plot twist. It's a coping mechanism, a survival strategy the brain creates in response to overwhelming trauma, especially during childhood. Why does dissociation happen? So why would the mind split like this? When a child experiences repeated trauma, like abuse, neglect, or extreme fear, they may mentally escape the experience through dissociation. It's the brain's way of saying, "This is too much. Let's shut it out." Over time, those dissociative experiences can become more defined. And instead of one unified identity, the mind develops separate parts to hold different memories, feelings, or functions. Each identity steps in to handle something the child couldn't fully process. It's not madness, it's protection. So what are the core symptoms of dissociative identity disorder? Well, DID is more than just switching personalities. Here are the main symptoms. The presence of two or more distinct identities or personality states. Memory gaps that go beyond ordinary forgetfulness. Feeling detached from oneself or one's environment. This is also known as depersonalization or derealization. Trouble remembering personal information, everyday tasks, or events that others say occurred. And significant distress in relationships, work, or daily life due to these symptoms. People with dissociative identity disorder may not even realize they're switching. They might, wake up in a different place, find unfamiliar items, or be told they acted in ways they don't remember. Let's talk about alters. An alter is a distinct identity within the person's system. Alters can have different names, ages, genders, skills, voices, and even medical conditions. Some may be confident and social, while others may be fearful, angry, or even childlike. Each alter serves a specific role, often created to handle certain emotions or trauma. And while it may seem confusing on the outside, it makes perfect sense to the system inside. Because for someone with dissociative identity disorder, these parts aren't random, they're necessary for survival. Let's now discuss some misconceptions and media myths. Dissociative identity disorder is one of the most misunderstood mental health conditions. Media portrayals often turn it into a horror story or criminal stereotype. But the truth is far from that. Most people with dissociative identity disorder are not violent. They're not dangerous. They're survivors, usually of prolonged, severe trauma. Their system isn't trying to harm anyone. It's trying to function in a world that was once unsafe. We need to stop labeling them as unstable or scary, and start recognizing their strength and resilience. How is dissociative identity disorder diagnosed? Well, diagnosing dissociative identity disorder isn't easy. It takes time, trust, and careful assessment from a trained mental health professional. It's often misdiagnosed as borderline personality disorder, PTSD, bipolar disorder, or even schizophrenia. People with dissociative identity disorder may be aware of some alters, or honestly, not at all. They may have been told they're just forgetful or too emotional. And because of stigma, many are afraid to open up, even in therapy. But, with the right environment, diagnosis can be life-changing, because naming what's happening is the first step toward healing. So, can DID be treated? Yes, treatment for dissociative identity disorder is absolutely possible. But it's not about eliminating alters. It's really about helping the system work together safely and with mutual respect. Therapy focuses on things like processing past trauma, improving communication between alters, reducing dissociation and memory loss, and creating internal cooperation, and, for some, integration. This is usually done through long-term trauma-informed therapy. There's no quick fix, but healing is real. And honestly, many people with dissociative identity disorder go on to live stable, fulfilling, and connected lives. If you or someone you know lives with dissociative identity disorder, know this: you are not broken. You are not a movie character. You are not your diagnosis. You are someone who found a way to survive the unimaginable. Your mind did what it had to do to protect you, and that in itself is an act of incredible strength. Let's stop sensationalizing mental illness. Let's stop whispering about things we don't understand. And let's start listening, really listening, to the voices that deserve to be heard. If this video helped you understand dissociative identity disorder better, please like, share, and subscribe. Because education ends stigma, and understanding changes everything. Don't forget to like this video, and be sure to check out our other mental health education videos.